Thank you for listening to American Medicine Today, brought to you by the Bonati Spine Institute. I'm here with Aaron Jacobson and Jeff Wagstaff, and of course, world-renowned orthopedic surgeon Dr. Alfred Bonati.
Well, I have some problems on the situation of the VA. Mm-hmm. I do believe that we need to remove the bureaucrats, the politicians, mm-hmm. and the PhDs that they create a lot of data and information. Really, we need to go to the experts. Mm-hmm. I really think the VA needs to be an institution that is exclusively designed for war injuries, where experts will take care of those war injuries. They cannot be for colds and backaches and toe aches and eye problems. They need to be the real experts in charge, so that the enormous bulk that you have right now mm-hmm. of people will not be waiting a month. If I have a problem and you as a patient, I go to a doctor and they give me an appointment for a month, I will look for another doctor. Mm-hmm. So we cannot make that the veterans are being submitted to that type of treatment. Needs to be an immediate treatment. So to be able to afford that, we need to remove all these situations of normal health problems out of the VA, have vouchers, so every vet will be able to go to any doctor that they want, wherever they want, and have a treatment for their needs. Mm-hmm. If it is a war injury that requires hospitalization, operations, and problems like that, or rehabilitation due to amputations or situations like that, yes, they're supposed to be treated there. So we'll reduce the amount of people that they are being treated, and they will have real experts. Mm-hmm. The other thing that we need to look, we need to use common sense. We keep talking and talking about the VA problem, but nothing's happening. You saw all the politicians jumping and going crazy when this situation raised a mm-hmm. couple of weeks, a month ago, and everybody of the politicians were making meetings and discussions mm-hmm. and things like that in radio and television. But it's just only a posturing. They are looking for recognition, so you remember the name and you vote for them. We need to stop this charade. We need to have a term limits for the politicians. Mm-hmm. They need to serve 4 years, then they need to go home and live with the laws that they created. And you will see that we don't need this type of professional politicians. Everything that they discuss today is a separation between Americans. Everything that they do is separate groups. They separate race, they separate gender, they separate economical position, they separate everything. Mm-hmm. So what happened is they have groups that they are going to vote for them. We need to stop this vote situation. Mm-hmm. We need to have results. In the VA, immediately, all these individuals that they are in the VA right now, they are pay, and the payment of this are clerks that are overpaid, mm-hmm. administrators are overpaid, okay. and other support staff is overpaid. They don't have review mm-hmm. of the how to manage these payments, because for 14 years, when they submit to some type of a change, those changes are being blocked by the same people who wants to earn the money without doing the job. Mm-hmm. The other thing is, remember when Reagan fired air controllers? how fast the situation was solved, how all these individuals that they were air controllers, that they were practically blocking the nation from safety, they were replaced by Reagan air controllers from the Air Force. And you know what happened? Everything got clear, no accidents. Everybody understood that this man was not playing games. Okay, why Obama, with all his mighty, doesn't go right now and fire everybody on the VA and put in charge physicians?
Because it takes leadership.
Well, the problem is, I understand that. So then, why don't we get rid of Obama? Because Obama is a problem in this nation today. And the problem is getting bigger and bigger, and it's not only affecting healthcare, it's affecting the way that we live now.
Well, he states himself, if you don't like what I do, sue me.
Well, the problem is, why to sue him?
Exactly. He should just be doing right by the country to begin with. Yeah.
Yeah. How do you get the power out of the politicians' hands? I mean, we talked about shorter terms, but that's pretty much a long shot. Without that happening, how do we get the power of controlling the VA out of the politicians' hands?
Very simple. What you do is you said the individuals that they are managing today, the VA, all the veterans, they need to go and say, everybody who is in charge of the VA needs to go home, and we need to get their physicians. They have shortage of neurosurgeons. They have shortage of family physicians, the specialties. So, but they are overpaying people that they are on the management, and the overpayment is enormous. They're on the millions. Or tens of millions. So what we need to do is we need to go and say, everybody that is in this situation, that's working more than, we need to remove the individuals that they are too long in one position and they are not responsible to it. If you cannot fire somebody, you cannot demand from that person responsibility.
Correct.
And that's a look at what's new in medicine today with Alfred Bonatti, MD.
I agree with you wholeheartedly, Dr. Bonatti. For people that listen to our program, not only are we on radio, but we're also on a television program called the same thing, American Medicine Today, and it is seen on ABC WFTS, Channel 28, as Saturdays at 7:30 p.m., or actually at 7 p.m. Make sure you tune in, and you will hear more from Dr. Bonatti about the Institute. We definitely talk to other doctors in the area with new medical innovations. And then, of course, we still continue to talk about politics and how it relates to medicine. Thank you for tuning in. You're listening to American Medicine Today on News Radio 970 WFLA. Make sure to reach out to the Bonatti Spine Institute, 855-267-0483 or Bonatti.com. We'll see you next week. Revolutionary in his field, Dr. Bonatti created, perfected, and patented the Bonatti spine procedures. Using his genius, Bonatti invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonatti spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonatti succeeds where others fail. The Bonatti Spine Institute is proud to announce more than a 94% patient-reported success rate in over 45,000 patent-protected spine surgical procedures. Call us today at 855-267-0483 or visit us at Bonatti.com.
All my pain is gone. Today I am totally pain-free. Nothing. No after effect.
I'm pain-free, and I have had to take any pain medication.
Today I am pain-free for the first time in over a year, and it is so awesome.
I only wish I'd known about it earlier. Right now, I am completely without pain.
Sitting here in this office right now, pain-free, eager to enjoy the rest of my life.
I am feeling great.
I feel 100% better, like a new person.
Today I feel absolutely fantastic. It's just incredible, the relief I feel right now.
Today I'm completely pain-free.
During the procedure, I literally felt the pain melt away. It was fantastic.
I feel so good.
It took care of my headaches instantly.
It's incredible. It's really incredible.
It gave me my life back.
It's just wonderful. I feel fantastic.
It is just absolutely amazing.
So I'm hoping to be climbing hills in a few weeks.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.